Hey gang, Dr. D here. Thanks for supporting the Vitality Hour. If you haven't yet, hit the like button and subscribe, and we'll keep bringing you revolutionary guests trying to heal the healthcare system and improve those who are afflicted by chronic illness and support ultimate optimal wellness in those trying to full throttle maximum physiology for their life. This episode is going to be a little controversial in the sense that it's going to discuss an interesting topic: vaccines. Remember, I am not pro-vax, I am not anti-vax, I am pro-patient. And for every situation, you have to thread the needle on HLA, immune system genetics, history, family history, the science behind current vaccines, and so forth. But our good friend Dr. Bill Blanchet has discovered something pretty exciting coming out of Cuba, a vaccine that can arrest stage 4 lung cancer. This is his story of what he has discovered is going on with Cuba, immunotherapy, and vaccines for cancer. And we want the world to know that Cuba and the States need to start integrating collaborations on what our healthcare systems are doing so that Americans can get the best in oncological care. I hope you enjoy this juicy, fun, riveting discussion. And remember, challenge everything politely.
All right, Bill, back in the pod.
Back in the pod. It's good to see you. Been a while.
Yeah. So, influenza, RSV, COVID. Today, we're going to get to a subject you want the world to know about, which is vaccines in Cuba.
Right.
And as the COVID virus continues to persist, on the road a lot I get, are you pro-vax or are you anti-vax?
Right.
And I said, wow. I didn't know that you could politicize the immune system. I had no idea you could politicize, but apparently we can politicize anything. And I tell people I'm not pro-vax, I'm not anti-vax, I'm pro-patient.
Right.
And at sirsx.com, I gave my talk on HLA vaccines and viral immunity. And my big theory that we've talked about before is on chromosome 6 for mom and dad, you have this human leukocyte antigen, and this is the part of your immune system that can recognize antigens. And for certain things like HPV, you're going to do very well at antibody tagging that, but someone else isn't. And that's why two people can have the same HPV. One gets squamous cell carcinoma of the cervix or the tonsil and goes into cervical or neck cancer. The other person has the exact same virus and does fine.
Right.
And they're a cigarette smoker or whatever, and obviously, we've talked in the past about it's kind of serenity prayer. Take control of what you can, let go of what you can't. You can't control what HLA you were born with, but we go out and teach the Fab Five, which is high EPA DHA, fat-soluble vitamins, including vitamin D and K2, glutathione, a good gut biome, feeding that gut biome and creating short-chain fatty acids, all in the peer-reviewed literature show immune coordination, immune modulation benefits.
So you just condensed about an hour and a half's explanation into one sentence.
Yes, Fab Five it. Yeah.
That's right.
And where I really felt a lot of power in that is Weston Price in the 1930s went around the world with his smarty pants wife, and they evaluated indigenous populations pre-Western civilization. Mm-hmm. And they didn't have chronic disease. They didn't have diabetes. They didn't have osteopenia, osteoporosis. The Maori had one cavity per 1,000 teeth evaluated. And what they had was 10 times the fat-soluble vitamins. They had high-dose EPA DHA. For better or worse, they never took an antibiotic. So maybe some people died of a plague or a strep, but they also never obliterated their gut biome.
Right.
And as a naturopathic doctor who's supported his own kids going on amoxicillin for strep to not die of rheumatic heart disease, I also know the first dose of antibiotic, we've obliterated that gut biome. We have to do the best we can to bring it back to what they were born with and what the breast milk built. But you can also do that with Golden Seal. So, you can also wipe out a gut biome and support the creation of a vaginal yeast infection off natural antimicrobials too.
Sure.
Right. And things like garlic will kill bad guys while sparing the good guys, but they're not strong enough for really intense infections.
Septic, right.
So we did this Fab Five thing, and I've been telling people, whether you're preparing for a vaccine or you're not going to be vaccinated, your whole goal is to get to the pot of gold antibodies with as minimal cytokine storms as possible. And we've talked about this, and I say I'm not putting on my tinfoil conspiracy hat when I say this. Not one person has died of COVID in this world. They've died of overzealous, nonsensical inflammatory responses to the COVID. When you
hit with friendly fire from your own body.
Hit with friendly, like how do I get pulmonary fibrosis and need a ventilator? Interleukin-6, tumor necrosis factor, TGF beta 1. Things don't fibrose if you don't have elevated transforming growth factor beta 1, whether it's nasal polyps or kidneys or liver fibrosis or pulmonary fibrosis. So how do we control that inflammation? And people say, well, vaccines are bad. I'm like, you told me, hey, have you ever held a dead baby Ruth in your arms? Yeah. Right? There would be a lot more dead baby Ruth if we didn't have diphtheria vaccine.
Exactly. Yeah.
We would have a lot more polio. At Fraser Meadows Retirement Community, I also treated a man who was in a wheelchair his entire life from the polio vax, sure. Right? So he took a hit. And you shared some of your patients with PI, with pulmonary
eosinophil, pulmonary infiltrates with eosinophil. Yeah.
Pulmonary infiltrates with eosinophil, which again is that the vaccine. The vaccine was the catalyst. It's the overzealous, nonsensical immune response to the vaccine. So right. What if that person got the vaccine Fab 5'd up? And at the end of the day, this is a gray area topic that needs individualized care, in my opinion, meaning what is your prior vaccine history? What's your vitamin D status? What's your exercise status? What's your sleep? Is your apnea corrected? Do you have a smoldering tooth abscess? Are you eating inflammatory foods? Do you have inflammatory midsection weight? Do you have concussion history? All that needs to be understood in regards to how you're going to do with the real virus, how you're going to do with the vaccine. But to say that you and I haven't, or at least I can speak for myself, I have 2 cases of teenage boy vaccine-induced myocarditis, and I have about 4 cases of COVID-induced myocarditis, right. or viral-induced myocarditis, right? And to say those both can exist right. Exactly. Off the same immune reactivity
Sure.
to the spike protein is nonsensical. So you and I were talking about these things as we always try and compare notes and do the best for our patient. And you said, well, the only country in the entire world that's not dealing with COVID right now is Cuba.
Well, the only country that's post-COVID right now.
That's post-COVID, excuse me.
Because there are countries that never dealt with COVID.
Yes.
Chad, Somalia, places like that. They never really had much COVID. Cuba had a ton of COVID during the Delta wave. And during the Omicron wave, COVID never showed up. Mm. And why is that the case? Mm-hmm. That's the thing that's got my attention.
Mm-hmm. So, as the naturopath, I'm going to say, hey, they're closer to the equator. And you probably have some spruced up vitamin D. And you're
what else is closer to the equator?
Dominican
Miami.
Republic. Yeah, Miami. Yeah, totally. And you're going to say, well, what about all the surrounding places?
Yeah.
And we might say, there might be a slight contribution. I would probably say, I would guess that Cubans and Dominicans might do more time outside than, a Miami stockbroker. But you have some specific local connections to the Cuban medical community. What are you finding down there?
Well, here's the thing. As you know, I've been to Cuba 8 times in the last 5 years, investigating, researching their immune-based treatments for cancer. Mm-hmm. And this was actually introduced to me by a patient who had stage 4 cancer who wanted to go down and get treated. And that's where the Nova documentary, Cuba's Cancer Hope, kind of features my patient, George, and his trip to Cuba and his experience with the Cuba vaccines. So that's what got me interested in Cuba, Cuban medicine, got my contacts with Cuba. Well, during the COVID storm, patients would have trouble booking a trip to Cuba because it was quarantine. Nobody was getting in, nobody was getting out because of COVID. And so I kept my ear to the rail, when's this COVID thing going to calm down in Cuba? And I knew that from the beginning, Cuba was developing their own vaccines. And my first thought, being an American, egocentric person that I am, was like, well, good luck with that, guys. But then they developed their vaccines. The problem with Cuba is it took them a while to prove the value, because during the Alpha COVID, the first time around, Cuba did a pretty good job of masking and social distancing. Mm-hmm. They weren't quite as rigorous as China was, but they really did a pretty good job, and they had very little alpha COVID. And so it's hard to test your vaccine's efficacy when you don't have very many people with the disease. Delta kicked their butts. And during Delta, they had plenty of people to test with. And they didn't come out with a vaccine until November of 2021, or late October of 2021. And within a fairly short time frame, they had 85% of the population vaccinated. And when you look at the numbers, by December, Delta COVID was gone in Cuba. And then Omicron shows up. And so in the United States, we have Alpha COVID, Delta COVID, Omicron. And Omicron's still rocking it right now. This past week in my practice, we diagnosed more COVID than any week since COVID has been a thing. So just for people who are living in a post-COVID world, guess what? We're not in a post-COVID world.
I saw Boulder and Broomfield County as the highest rates of all time right now.
Absolutely. And when you look at what's reported nationally, they're saying 90,000 new cases per day in the United States, which is probably a dramatic underestimation because most people are getting COVID based on home tests, which are very accurate when they're positive, but never get reported to the CDC, so never get reported to the WHO. So 90,000 new cases per day is probably a dramatic understatement. The 400 to 500 new deaths per day is pretty real. And the 4,200 new hospitalizations per day is pretty real. So we're not post-COVID. It's just not quite the shiver me timbers thing that it was.
It's more
in March of
a strong
2020.
coronavirus flu than our scary Delta days.
Yeah. Or the Alpha COVID, the first one to come out. I couldn't keep my mouth moist because it was that anxious.
Kicked my butt. Yeah, it was June 2020, Alpha variant, and then January 2022, Omicron. And I did home test, and Ozzy got it first. And then Sarah's like, you probably don't have it. I'm like, honey, I have the exact same symptoms as he does, and he tested positive. Out of my own curiosity, I did home tests every 48 hours, and it was the 10th day that I showed up.
Yeah.
I was long shedding and spreading before I was definitively positive.
Yeah. And, and ironically, you talked about injury from your own immune system. I've almost for sure had COVID twice. I had all the symptoms, classic presentations, the whole thing. I've never been able to find a positive COVID swab by any mechanism. So I think my immune system gets in there and kicks the virus so fast that I can't get a positive test, but kicks me at the same time.
Right.
And so I pay the price for my immune system being so vigorous. So getting back to Cuba, what Cuba did back in March of 2020 when COVID was first coming out, they decided to create their own vaccines. And they created 5 different COVID vaccines. And of those 5 COVID vaccines, they picked the 2 that seemed to have the greatest efficacy. And one of them, they've been doing their own vaccines for a long time. And they have a platform for their hepatitis B vaccine. And within the platform, you have a set of proteins, a set of antigens, plus the antigen you're going after. These other antigens kind of stimulate an increased immune response against this antigen you're going after. And so with hepatitis B, they have their platform with hepatitis B antigen. They took the hepatitis B antigen out of that platform, inserted the COVID spike protein antigen, made it through replicant DNA, and had a old school antigen-based vaccine that was 92% effective against alpha COVID.
Wow. Basically
the same realm as we're seeing with the mRNA vaccines in the rest of the world. But at the same time, they said, and this is a coronavirus, it's going to change. We can anticipate new variants. So they said, let's create a second booster against potential future variants. So they came up with a second booster against future variants. And to do that, you'd use a different protein on the virus. And they took their Haemophilus influenza platform, pulled out the H flu, inserted a different protein, different antigen from the coronavirus, and got a second vaccine. And so 85% of the population now has been vaccinated with both vaccines. And so even though Cuba today, and for months, doesn't mask, doesn't socially distance, doesn't test tourists coming in from other countries, and tourism is a big part of what keeps Cuba alive, they for a while got down to 2 cases per day while we were having 40,000. Now that we're up to 90,000, they're up to 12. 12 new cases per day in an island of 11 million people.
Wow.
That's pretty amazing. And so one of the things that occurred to me, is that really what's going on, or is this just reporting? Maybe we're just not reporting cases. So the last 2 times I was in Cuba this year, I asked everyone I met. I was just obnoxious. I asked everyone I met, doctors, nurses, janitors, taxi drivers, tour guides, how many people do you know who've had COVID in the last month or so? The answer was uniformly 0.
Wow.
On 2 separate visits, separated by about 3 months. 0 new cases of COVID. The only exception was a tour guide who had 2 Italian tourists with COVID, but no one in Cuba got it from these Italian tourists. And so it really looks like the Cuba vaccine works. So the United States, Alpha, Delta, Omicron still rolling. Cuba, Alpha's kind of flat. Delta, they got hit pretty good. Omicron, nothing.
Well, I want to share for our listeners what I think is going on there. And when you make a spike protein variant, you chose a very distinguished antigen. Antigen just means protein or puzzle piece. Think of this Ozo cup here. You chose this. And then you said, hey, we're going to make antibodies, a lid that fits just this.
Yeah.
And that's called monoclonal antibodies, right? And we like monoclonal antibodies when we just want something to grab and tag a cancer cell and spare healthy cells, right? Because these cells, a cancer cell started as a healthy cell that went rogue and has all kinds of novel new proteins. If I can find one that's just cancer and not healthy cell, that's my monoclonal therapy, and I can tag that and assassinate that cancer. What Cuba did is they put other antigens in there to make a polyclonal, a multiple antibody coronavirus. So they're saying, hey, this lid can fit over here. Look at that, not too bad.
Yeah.
And this lid fits close enough over here. I don't know why I have 3 drinks going. Didn't anticipate this, but not too bad. And I really think they created a brilliant polyclonal phenomenon.
And so the thing that makes me crazy, and that's a sharp walk, let me tell you, but the thing that makes me crazy is 90 miles south of Miami, the researchers there, the clinicians there, the immunologists there have made COVID no longer a public health consideration. In this country, the greatest country in the world, COVID is still a public health consideration. The vaccine rate is about the same in the United States as in Cuba. And yet, in this country, COVID remains a major disease that's costing us billions of dollars. Billions of dollars both in revaccination, billions of dollars in treatment with Paxlovid, and I love Paxlovid, but it's costing us billions of dollars to treat with Paxlovid, plus billions of dollars to hospitalize 4,000 more patients every day with this Omicron. And then the 400 or 500 per day who are dying from COVID still is just a tragedy. In Cuba,
and the spectrum of trauma on a family who lost a family member, but then just the tension and uptight inconvenience of you have a wedding and now you have to reschedule all the nonsense in a society that doesn't trust their CDC or their public health anymore. And people ask me, why are you cynical? Why do you, and I sit in a similar category as you where don't throw the baby out with the bathwater, but I have to sift through everything from our public health. And people say, why do you need to do that? And I said, well, in 1980, when I was in my parachute pants and my Motley Crue t-shirt, right, in 8th grade, they told me cholesterol is predictive of heart attack and stroke. And they told me that I should fear fat and eat the food pyramid, tons of inflammatory diabetes causing grains, low fat, and literally turn that pyramid upside down, you have a healthy diet. They told me that salt is Satan and eggs are the devil, right? And they told me nerves don't regrow. And we know from some of the work of Dr. Richard Shoemaker, we are literally regrowing brains on pre and post brain MRI. And that has always stayed with me to say, could you ever imagine a world where Pfizer, Moderna, lobbyists, politicians, Fauci, and people who are in high healthcare positions would be humble enough to go down to Cuba and say, what the heck are you doing?
I think the first mistake that we as egocentric Americans do is assume that Cuba can't possibly have anything in the scientific world that we don't already have. And the fact of the matter is they do. The fact of the matter is they do. They've been developing this immunologic research in a separate chimney of research, separate from the Western world, because they've been separated from us by this embargo that we've had since the 1960s. And so, but they're very bright folks who are well-trained, well-educated, who, I mean, they're not, you know, I'm not endorsing Cuba as a country. I'm not endorsing anything about Castro or his regime, but I'm not endorsing what we're doing either. I'm just talking facts. Here's the facts. They have some really amazing immunologic researchers who have come up with a vaccine that's different than any vaccine in the world. And in Cuba, they are post-COVID. When I ask the people in Cuba, how many people do you know with COVID, they'd roll their eyes and say, we've been vaccinated. We've been vaccinated.
Where here, it's this contentious, split-up family decisions on to do that or not. And you see a report of a $35 billion profit for a Pfizer. What I found when I was in China touring hospitals and stuff for the Master of Acupuncture is I met a medical doctor there, and you didn't get paid much more than the garbage men.
Oh.
Right? And there was a little bit of prestige to it. But what it made me realize, and I am, very pro freedom, very pro intellectual freedom. I think that good ideas should get monetized, and there's nothing wrong with that. But that can go. The dream of ethical capitalism can go wrong very quick, just as quickly as the dream of communism. But what I thought, I still reflect about, that's over 20 years ago, is that guy goes to work because he wants to be a doctor, not because of a paycheck or a Porsche or a Tesla Plaid, wants to solve healthcare problems. Do you see a difference in the ingenuity of the researchers, the doctors down there, and what gets them out of bed in the morning?
Well, I think it's true for most researchers that you have a passion for what you're researching. And I've had the opportunity to talk with some of the primary research people who are on the benches doing their work. And the passion they have behind what they're doing is palpable. You can tell that really matters to them. So there are 2 points I want to clear up that we've skipped over. One is the death rate. We're having over 400 new deaths per day in this country from COVID. Cuba, since May 10th, has had one death in Cuba since May 10th. So even though Cuba is a smaller place in the United States, that's a big difference. That's a huge difference. The other thing is when we talk about 12 new cases versus 90,000 new cases, in this country, most cases are home kits. In Cuba, all cases are by going to your doctor at the end of the block. They do it there, and it gets reported. And so I would submit that it's not a function of underreporting in Cuba. It's probably more accurate reporting in Cuba of case rates than in the United States because they don't have home kits to do COVID.
And that's some weird extension of communist countries, right? They can collect data by mandate,
right? Yeah.
Versus, I'll get tested. Who don't want to get tested? And
then the other thing you said that the doctors make no more than garbage collectors. Let me be clear about this. I can go a long damn time before I get to see my doctor again. I can't go a month without my garbage collector. Okay, so let's not underplay the value.
No,
of garbage collector.
I'm just talking about you know where I'm coming from.
Yeah,
but people give their kindergarten teacher the apple. They're the gold star overachiever. They have a heart to serve as they go into conventional and sometimes naturopathic medical school, and then they get polluted by asset sometimes, and I think,
how do I monetize this thing I'm using to treat my patients with?
Yes, that's right.
Here's a test, doc. This is what it's going to make you.
Yes.
It's like, I don't want to hear what's...
Yeah, and whether it's the chiropractor who needs to do the 300 adjustments a day or the dentist who has to do 50 dental devices that only have a 30% cure rate for apnea, or you're always vulnerable to chasing money over patient outcomes. In this country. And it feels like in Cuba and China when you're over there, it's like, Definitely for worse on some level. There is no, holy grail windfall blockbuster drug that you're going to make and buy your island in Tahiti. It's just about helping people as a doctor.
Yeah, well, back with the polio vaccine.
Mm-hmm.
And when the polio vaccine came out and they asked, are you guys going to patent this? And the thought was, no, you can't patent this, son.
Mm-hmm.
This has to be available for people.
Mm-hmm.
Well, that's no longer the thought process.
Mm-hmm.
The companies that make these vaccines are making tens of billions of dollars off of these vaccines. There's no question about that.
What a generous stud he was. I can't remember his name, but I remember.
I'll think of it in a second.
Yeah.
But at any rate,
yeah.
So why is it? Help me understand this. Why is it that 90 miles south of Miami is an island of 11 million people that are post-COVID, and no one in this country has gone down there to check that out?
Mm-hmm.
You haven't heard it on any news reports. You haven't heard it talked about. Well, here's where it's going to be talked about. You heard it here first, okay? Stay tuned. We look at the disaster in China, the COVID disaster in China. The problem with China is with alpha COVID, which had an R-OT value of 2.3. Let's say for everybody infected, they made 2.3 people infected. China shut down. They did a zero COVID tolerance and shut down COVID in China with alpha COVID. So they thought, we know how to handle this here in China. The rest of the world's stupid. Now we've gotten to Omicron, which is 8 times more contagious than alpha COVID. The masking and social distancing, the zero COVID tolerance policy no longer works. So right now, China is shutting down their economy, and they're still dealing with COVID. And it can't work with something that's as contagious as our current Omicron. And so we over here are smugly saying, ha, 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 those Chinese, they're in for it. Their vaccine's crap. They're in trouble. Well, here's the secret. Look it up. China is doing a joint venture with Cuba. If over the next 6 months, COVID disappears in China, and we're still fighting this battle in this country, we'll know why. It's because they looked at Cuba and said, holy cow, look what happened in Cuba. Mm-hmm. Let's bring that technology to Asia. Let's vaccinate the folks in China with this vaccine that actually works to prevent COVID. Now, the vaccine we have, the first vaccine prevented alpha COVID. The subsequent vaccines have not prevented the variants and have not prevented infectious contamination from people with the variants.
So let's talk about that. As me with my naturopathic background being a little more skeptical, you with your medical doctor background, and also having 4 decades of practice under your belt and seeing the benefits of eradicating polio and diphtheria and some gnarly stuff. You have your own story about measles and so on and so forth. You told me the other day 75% of the COVID cases we're seeing right now are boosted.
In my practice.
In
yes.
your practice.
My practice.
Yes,
75% of the new cases coming in right now are patients who are boosted.
Yeah.
So let me be completely clear and transparent on this. With the alpha COVID and with delta COVID, we were filling up our hospitals with COVID patients. The vaccines aren't perfect. The vaccines have side effects. But we weren't filling up hospitals with vaccine side effects. We were filling up hospitals with COVID. We're filling up morgues with COVID. So when it comes to, am I a fan of COVID vaccines? I am absolutely a fan of COVID vaccines with alpha COVID and with delta COVID.
Yeah.
With Omicron, we now have a bivalent booster for Omicron that's supposed to be beneficial. And we're in this, urgency about getting the next vaccine. So we released this vaccine before it was tested in humans for efficacy. And so we have this vaccine that we know increases antibody levels, but we don't know by what percentage does it reduce COVID. Does it reduce it at all? We don't know by what percentage does it reduce infectivity in the person who's vaccinated. And it looks like it probably doesn't reduce infectivity at all. We assume it makes the case milder. But we're dealing with Omicron, which is a much milder version of COVID than the first one. And 2 weeks ago, I had a patient who's never been vaccinated one of my very few patients who've never been vaccinated, and the patient whom I said, you shouldn't get vaccinated because her brother died after being vaccinated from myocarditis. Her sister had an aggravation of her arthritis after being vaccinated, and she has autoimmune issues going on. It's like, I agree. You should wait this out. Unfortunately, there's no waiting this out. Initially, we thought we could wait it out. There's no waiting it out.
That tribe right there is the people that I want to test HLA on.
Yeah, exactly.
What is different about her immune response genes specific to this coronavirus?
But the good news with her, despite her lack of vaccination, I got her on Paxlovid, and she was a little reluctant to take Paxlovid. She took it. She sailed through this Omicron, no problems.
Yeah.
But she was also replete with vitamin D. She had zinc on board. Yeah, she took some C. She was doing the things that you need to do to minimize the ability of the coronavirus to take over your body in the first place.
Yep.
And she was doing it all, plus the Paxlovid. She sailed through it just as well as people who've been vaccinated. And so I want someone to show me what's the value of this new vaccine. Because any vaccine is going to have a downside. Show me the value exceeds the downside. And that's yet to happen. The good news is we're not seeing huge downsides with this bivalent vaccine that exceeds previous vaccines. But that's damning with faint praise.
It's just not.
I like this vaccine
it's just
because
not
it's not
working.
much side effects.
Yeah, right. It's like from the beginning for our listeners, the way I navigate individual healthcare is I say, with your history of autoimmunity or past vaccines or chronic inflammatory response syndrome, et cetera, is the cytokine storm to get to antibodies worth the vax, right? And I can make a case for that during Delta. I can make a case for that during Alpha. I can't make a case for it anymore. Relative to what else we do in our clinic.
Well, in order to make a case, you have to have some data, and we're completely lacking data.
We are lacking data, but when I go out and teach nationally, I'm asking doctors like you, are your boosted patients still coming in with COVID? And the answer is feverishly so.
Yeah.
And I said, well, this isn't a Cuba vaccine that probably has a polyclonal effect and is actually shutting down. This is a cytokine storm that's not that may be a weaker cytokine storm because we're seeing less side effects, but it's not stopping these people from getting Omicron. And that's the part that frustrates me with ego and public health. Like, why can't you say we got what we're going to get out of that? Let's go down to Cuba, see what they're doing, maybe have something that's a better option, and put a bottle of vitamin D in everyone's mailbox with adult, teenage, and kids dosing with literally a free blood draw to make sure your levels are 50 to 100 for 25 hydroxy vitamin D3 on lab.
And here's, again, among the things that are frustrating with healthcare. We know that Paxlovid works, and Paxlovid works very well. I love Paxlovid. 90% effective in preventing hospitalizations, 100% effective in preventing death in the study that got Paxlovid approved. And my experience with Paxlovid is it shuts down the virus in a hurry. Got nothing against saying, let's go with Paxlovid. I've got nothing against saying, let's go ahead and get a booster because it might reduce the severity of disease. I wish I had more data, but it might reduce severity of disease. And I can remember a time this was a deadly disease. So PTSD, maybe go ahead and get the booster, even though I really wish I had some more data. But here's the thing that makes me truly crazy, is when you look at vitamin D3, something as simple as vitamin D3, and go back to Wuhan, where there's a 10-fold difference in the incidence of COVID during the first COVID back in 2019, 2020. 10-fold difference between the incidence of COVID, clinical COVID, based on vitamin D levels. And then subsequent studies in Germany and Israel, where they found an 8-fold difference among patients who have COVID, an 8-fold difference between hospitalization versus no hospitalization based on vitamin D levels. And then another study showing an 8-fold difference in mortality among hospitalized patients based on robust versus non-robust vitamin D levels. And so reduced the incidence of clinical COVID, reduced hospitalizations 8-fold, and once hospitalized, reduced death 8-fold. And yet we're still running around with our finger on our nose saying nothing about vitamin D. Zinc, simple old zinc. For years there have been a subset of researchers say, zinc's pretty potent antiviral. You ought to be using zinc for antiviral. Be using zinc. And I was an idiot. I said, yeah, right. Yeah. If zinc was so good, people from Harvard would be telling me zinc is good. I don't hear anything from Harvard.
Well, that's why one of your Christmas presents was Textbook of Nutritional Medicine by Alan Gaby, and the amount of solid evidence-based natural medicine in that book, including zinc. And I tell people all the time, should I take Paxlovid? I say yes, and even consider 2 5-day courses, because it's simply a protease inhibitor. And so is zinc. And all that means is it blocks an enzyme that the virus needs to replicate. And some of our patients who have suffered, I always tell people herpes family viruses are secondary. When you have really bad varicella chickenpox, when you have just cold sore after cold sore after cold sore, you have to go, what is undermining my immune system at a deeper level? Do I have a tooth abscess? Is it apnea? Is it chronic inflammatory response syndrome? Did I just finish chemo? Do I have HIV progressing to AIDS and I haven't gotten on antiretrovirals yet? So I've never seen herpes family viruses replicate. And I'm seeing people with SIRS, with the water damage building stuff, who are coming in with shingles in ways I never saw before I had a specialty in that. I saw it at Fraser Meadows Retirement Community. And I say, hey, you know how we give Valtrex or acyclovir or valcyclovir for really chronic HSV and you just can't have comfortable sex without having outbreaks, you're having cold sores all the time. That's all Paxlovid is, but it's specific for coronavirus. It blocks that. But guess what else does that? Zinc. It's just Paxlovid's a little more robust in that moment to shut down replication.
So let's take a second to talk about our therapies for COVID. With Paxlovid, for Paxlovid to work, we want to get it started within 5 days of the onset of symptoms. For the antibodies to work, which kind of don't work anymore, but the synthetic antibodies to work, you have to get them on board before their oxygen level starts to drop. If you wait until their oxygen level starts to drop, it's too late.
And you're talking about the monoclonal antibodies
the intravenous antibodies you can get, which at one point in time were, before we had Paxlovid, were the most effective treatment. Now they have Paxlovid beats them. But they're losing their efficacy because the virus is changing now.
It's the exact same reason why the boosters are losing their efficacy.
Right.
It's the same puzzle piece that's disappearing. So you need a new monoclonal that's specific to the corona.
And so, but when they were working, you had to do them early. By the time you got into the ICU, the only thing that worked was IV steroids and prayer, because that's all we had.
Treating the cytokine storms again.
Somebody did a zinc study among ICU patients in a major research, tertiary care medical research center, and found the individuals receiving zinc had decreased durations of hospitalization and decreased mortality compared to those not receiving zinc. So in that setting, the only other thing that changes outcomes is steroids. Adding zinc changed the outcomes in the ICU setting.
Brilliant.
That's big. And yet, what do we hear from the CDC or the NIH or from the American researchers about zinc and COVID? Crickets.
I'll tell you what you hear. It's too cost effective and you can't patent a natural mineral.
Well, I like to think that the people who run the CDC and the NIH are good people. But the problem is, it's not their job to ferret out cures. It's their job to pass judgment on the cures that are brought to them. The only people who can afford to bring cures to them are people who are hoping to make hundreds of millions, if not billions of dollars from the cures. And so the zinc manufacturers can't afford to fund a $100 million study to show that zinc should be used in all populations with COVID.
It's a gnarly system to have during a pandemic where you need to be nimble, data-driven, cost-effective, gnarly.
And so if I were to change the NIH or change the WHO, I would say, okay, let's redefine your job. Your job is not only to look at what comes in from Big Pharma. Your job is to get your eyes open, look around, and talk to idiots like me who say, check this out. And then go fund and check it out.
Yep.
Check it out. Go down to Cuba. Check out their vaccine in Cuba. Don't wait for Cuba to bring the vaccine
Right.
to
We
you.
can show
Go
some
down and check it out in
pilot
Cuba.
trial data on how much heart attack and stroke you're preventing. We can show pilot trial data on the decreased mortality rates in our patient populations. Knock on wood, we have 2 ICU admissions, no COVID deaths in a cohort of 2,000 patient contacts. I mean, we're proud of that, but when people say, hey, what do you think of Paxlovid? I say, yes. Is that a replacement for your zinc? No. They are both protease inhibitors. Paxlovid, from the data you could extrapolate, is a little more potent than that. But zinc has non-protease inhibition, other aspects on organizing your immune system. And then I tell people, like, when you're in active COVID, we do 30 to 90 milligrams of zinc, and you have to take it with food or you can really get that zinc belly. And then when you're done, you stay on 30 milligrams for at least a month or two. And our LabCorp request serum zinc functional range is 110 to 120, because a lot of times what happens is after you go through a cold or a flu, you've now depleted your vitamin C, you've depleted your zinc, you've depleted your glutathione, your vitamin A, your vitamin D. So what happens when when RSV comes or influenza comes? You're entering that in a depleted pro-inflammatory cytokine state. And something that could have been very mellow for you to handle with some supercharged vitamin, mineral, clean diet, good night's sleep, oxygenated sleep, flossing is now murderous, And before we go, in regards to this question, are you pro-vax or anti-vax? And I say I am pro-patient, right? And things that make me go, like that old song, is, wait a second, George on Nova, and you're in that episode. If you guys haven't seen it, just do Nova, George, Cancer Cure. It's Discovery Channel, right?
Cuba's Cancer Hope, it's Nova.
Cuba's Cancer Hope, Nova. And you'll see Dr. Blanchet in a little glimpse of a doctor who is willing to go the extra mile for his patient. George came to you, right, with this potential lung cancer stabilizing idea,
right,
coming out of Cuba. Can you share the non-COVID Cuba vaccines and cancer story for our listeners?
Yeah. So like I said, Cuba has been doing their own immunologic research separate from the rest of the world. And they've come up with some things. I had a chance to have dinner with one of the primary researchers, one of the big researchers in the oncologic immunology world in Cuba. And stuff that she has insight to that we just don't even have a clue about in this country is pretty remarkable. So there's a wealth of information down there. If we just normalize relationships and go down and learn from them and have them learn from us, I think the combination of what we know and what they know put together is going to be more than the addition of those two things together. They're going to multiply. They're going to be exponentially improving what we're able to do with cancers. So Cuba, for hard cancers like lung cancer, colon cancer, actually pancreatic cancer, glioblastoma in the brain, they've developed 3 different immunologic approaches. 2 of them are monoclonal antibodies, and one of them is a vaccine. And these antibodies work with our body's immune system to help direct our immune system to stop cancer growth or to actually kill the cancer cells. Does it work 100% of the time? No. No cancer treatment works 100% of the time. Does it have a benefit? Yes. Does it have side effects? Almost none, because these are laser-focused treatments. These are not chemotherapy that's designed to kill more cancer cells in humans.
That monoclonal antibody is bred to just tag something very unique and different on that cancer cell, while sparing our healthy cells, unlike radiation and chemo, which actually do a pretty darn good job killing cancer cells, but they also kill some of our healthy cells. Yeah.
And so not to take anything away from what we've been able to accomplish in this country with monoclonal antibodies and harnessing our immune systems, but Cuba has come up with their own chimney of research looking at the same things, and the difference is they have 20 years experience using them. We're just starting to use them now. They've been doing it for 20 years. When the Nova documentary, Cuba's Cancer Hope, they feature one patient in Cuba who's been dealing with stage 4 lung cancer for 17 years.
Wow.
And her treatment is to get a vaccine every 3 months. So every 3 months she goes in and gets a shot. Essentially no side effects from the shot. And the shot just takes epithelial growth factor out of her system so that the cancer needs epithelial growth factor to grow. It stops growing. And she just goes about her daily routine, and every 3 months goes back in and gets a
17
vaccine.
years for the listeners. What is the life expectancy on an average stage 4 lung cancer?
Before the advent of the current generation of medications in this country, which came out about 7 years ago. Some of them came out about 3 years ago. But before that, the average life expectancy was a year to 18 months tops. Now we've been able to improve the life expectancy on specific cancers, not on all. But if you have certain genetic mutations, epithelial growth factor mutation, for instance, we can see, 3 to 5 years.
As standard of care, or I got to know the right people and know how to kick in doors and advocate for myself?
It's standard of care. I mean, we can expect, I think the average response to the epithelial growth factor mutation drugs is about a year and a half, 2 years. But some people, get more, a very good quality life from that in this country.
So what have you seen with the patients that you've connected with the right researchers with cancers in your clinic?
Well, the best example is George. And George did have stage 4 lung cancer all over his body, one in his brain, chest, abdomen. But he had the epithelial growth factor mutation, and they put him on first Tarceva and then Tigresso. And he got a year and a half, almost 2 years out of it, and the cancer started to grow. At that point in time, they were talking about what kind of chemotherapies they were going to use, and George was not particularly interested in chemotherapy, and he found this thing in Cuba. And in October of 2017, we fly down to Cuba. George gets started on Vaxira. Vaxira is a monoclonal antibody that targets a specific antigen only found in cancer cells. And so when the antibody hits this antigen in the cancer cells, it triggers the body's immune system to kill that cancer cell. He got started on Tarceva in October of 2017. By June of 2018, he had no detectable cancer anywhere in his body by any mechanism for detection.
Well, not the Tarceva, the
Vaxira.
Vaxira. Yeah.
He stayed on the Tigresso, he stayed on that, which is like Tarceva. It's a for the epithelial growth factor mutation. But he added the Vaxira, and his cancer, which had been stabilized by the Tigresso, disappeared.
Miracle.
Went away.
Unbelievable.
And he had a fabulous benefit from that until he could no longer receive it. When he could no longer get the vaccine because of Cuban-American relationships, his cancer rapidly progressed. They then did put him on chemotherapy, and he went through 3 rounds of chemotherapy, which caused fairly substantial side effects. And only the 3rd round showed a regression of his tumor burden. But the side effects from the 3rd round ultimately was his undoing. And so he died after 3 rounds of chemotherapy. But his response to the immune therapy was brilliant. And had the door stayed open to Cuba during that time frame, they could have continued to go down there. Who knows if George would still be running marathons today.
That's a hellacious mind bender.
Yeah.
How would you feel as the patient to have access to something that's literally eradicating your cancer and then get cut off? Your family, your doctor. I know you had your own grief about that.
That was unpleasant. And the only redeeming reality that kept me sane about it, our federal government's decision to further, curb relations with Cuba, is the fact that not long after that happened, COVID happened, and so he would have been cut off with COVID anyhow. Now, but he would have, almost certainly gotten a couple more years of quality living, because the medicine stopped a year before COVID started. So he stopped his medicine a year before COVID, and he got sick during that year and had chemotherapy that year. And if we could have continued the Cuban monoclonal antibodies, he probably would have had a great year.
Man, what a disgusting, complicated, unintegral species we are. Like, that's just really, I've never heard the details on.
Having gone to Cuba multiple times and having developed friendships and relationships and knowing the doctors there and knowing the doctors' motivations there and seeing what they're able to do, and then to understand that the United States has declared them a state sponsor of terrorism based on something that happened 20 plus years ago. I have trouble getting my head around it. I mean, we may or may not agree with the government down there, but I haven't heard of Cuba sponsoring any terrorism anywhere lately. And yet we are depriving families from being with each other. Between our embargo and COVID, we've so successfully impoverished that island that people are dying in the hospital for lack of IV fluids and oxygen. And yet we can't undo what we've done. We can't really rethink this. Maybe that's why we can't look at the vaccine.
Sure.
Is because we've made Cuba a state sponsor of terrorism, therefore we can't look at their vaccine. But if that's the case, we're paying the price for our actions, because that vaccine could save this country tens of billions of dollars, not to say nothing of 400 lives per day. 4,000
Well, and that's even before you
per day.
get into the oncology world of what they're doing and the Georges of the world.
That's just looking in our world of COVID. That's not looking at the bigger world of lung cancer, colon cancer, breast cancer, uterine cancer, pancreatic cancer.
And in the world of politics and nuance, I can appreciate what we're going through with China, right? What you just explained is this is a different relationship that's kind of getting thrown in the same bucket. And at the same time, I'll have to tell you, I was in China in 1998, and the actual people, the human beings living there. I remember it was so funny because I was so excited to be like, what's it going to be like to be a minority, and ironically people were like, Michael Jordan, President Clinton, and they wanted to take, this is 1998, right? They wanted to take like pictures with the American guy. It was silly, but I had so many connections with people, including I played soccer on a sandy beach with some Chinese military. And I just remember like, wow, this is so stupid that we can't have access to learning from each other, helping each other. And every time you come home from Cuba and what they're doing with oncological care and immunotherapy, they are so ahead. And we are so egotistical about getting real with that. And we probably have monetizing barriers around accessing that medicine, right? I mean, what would all the let's just say you were a health czar and tomorrow we said, hey, we're going to just broker medical relations. You give us your vaccines, we'll give you IV fluids and so on and so forth, right? Yeah. Just a little quid pro quo stuff. Is there any way we could have access to them without having the $36 billion tag on a Pfizer vaccine?
Well, the thing is, I don't know the answer to that question, because I think, in this world, when we look in this country, when we look at the things that work, it's the things that do have the big profit margin. And so if we came over and just had this vaccine as something readily available,
right,
but didn't have the marketing push behind it that $30 billion can do for you, would anybody know about it? Would anybody care about it?
After you spouted off the vitamin D studies, it's going to be probably a similar phenomenon.
It might be.
Well, thank you, Bill. One day, one person, one patient at a time.
Yeah. And if 6 months from now, China no longer has a COVID problem and we still do, it's because they
you heard it here.
They took the time to check out the Cuban vaccine, and they have a joint venture with Cuba to create the vaccine for China.
Thanks for sharing what's going on in the world, and I hope we can get there.
All right. Yes, we're going to push. Fight those windmills.